Private notice question on HIV and AIDS. Lord Fowler.
My Lords, I beg leave to ask a question which I've given private notice. The question is to ask Her Majesty's Government what assessment they have made of the progress that has been made in the United Kingdom and globally in reducing HIV and AIDS since World AIDS Day in 2020. And I declare my interest as an ambassador for UNAIDS.
Well, can I start by paying tribute to the Noble Lord for his work as the Ambassador for UNAIDS and also for following this issue ever since the 1980s when the Noble Lord was Secretary of State. I think we should recognise the long commitment that the Noble Lord has made to this issue. We believe that the UK could be proud of its efforts. Since last World AIDS Day, the UK signed up to the progressive and ambitious political declaration at the UN high-level meeting in June and declared our commitment to deliver a new global AIDS strategy. So the world has the best chance of meeting the 2030 goal to end AIDS altogether. Also domestically, Noble Lords will be aware that we have published a new HIV action plan.
My Lords, thank you. My Lords, this is World AIDS Day and the international position is anything but encouraging. Has the Minister seen the reports of the serious setbacks that have been in the fight against AIDS over the last year, with testing figures down by 40% and with an annual death toll of over 660,000? But will he join me in paying tribute to the many non-government organisations and volunteers around the world whose efforts have prevented the toll from AIDS becoming even more catastrophic?
I'm sure all Noble Lords would like to join the Noble Lord Fowler in terms of celebrating the work of the NGOs. And sometimes when one looks at the aid, and quite often a lot of aid is government to government, sometimes that may well be a barrier in reaching those who need to help, especially in countries where the people who are suffering from HIV are discriminated against or stigmatised. And quite often the best way to reach them is not via government, but via these NGOs. So, of course, I do pay tribute to them, and as I'm sure all Noble Lords do.
My Lords, the Global Fund to fight AIDS, TB and malaria has saved 44 million lives since being founded 20 years ago. And it's estimated that more than 3 million of these were saved by thanks to UK aid. Therefore, will the Minister confirm that continued close partnership with the Global Fund will remain a central pillar within the UK Government's planned international development and global health strategies?
Well, can I thank the Noble Lord Cashman for the question, but also once again pay tribute to his work during our many years in the European Parliament together, where he was a champion for LGBTQ+ issues, but also HIV and AIDS awareness. He was probably one of the strongest champions. My only regret is that I was not able to champion as strongly as I wanted to ethnic diversity and lack of ethnic diversity in the EU. Of course, we remain committed to the Global Fund, but also other partners, including UNAID and UNAIDS, and also the Global Financing Facility. It's important that we all work together on this issue, not only in our own countries, but particularly in those countries where it's very difficult, where people have challenging health systems, but at the same time, in those countries where, unfortunately, gay people or people suffering from HIV are discriminated against or even stigmatised. And one of the things we can be proud of is in the UK, we stand up for those people.
My Lords,
years, this country has led the international efforts to overcome HIV and AIDS. We have done so by leveraging our contributions to international funds. Unfortunately, in 2021, those were significantly cut, and that jeopardises world-leading research at a point when we are very, very close to some game-changing treatments and diagnostics. So will the FCDO review please look, as a matter of urgency, at restoring the funding for UNAIDS and UNITAIDS?
Well, I'm sure Noble Lords understand what the reasons for looking at some of those cuts in terms of the pandemic and needing to redirect resources. But we are committed to continuing in terms of funding, but also working at an international level. In fact, this issue has come up in a number of G7 and international health meetings that have been attended by UK representatives. But the UK is seen diplomatically and on the diplomatic circuit as one of the leaders standing up for the rights of both gay people but those who have HIV and AIDS.
Does the government's welcome new commitment announced today to ensure that home testing
is available throughout the country. Does this mean that anyone who wants a test will be able to get one throughout the year?
Can I just say thank the Noble Friend for the question. I'm pretty sure the answer is yes.
Generic drugs were crucial to the global response to HIV and AIDS. I see the Noble Lord the Minister nodding. In which case, will we learn that lesson for this pandemic and stop blocking the TRIPS waiver so that we can better vaccinate the global south and protect ourselves from new variants?
Yeah.
Well, one of the best ways to help vaccinate people across the world is by multilateral, bilateral and plurilateral partnerships. You know, we are donating 100 million coronavirus vaccine doses by next June. We are committing to work internationally. This issue comes up at the G7, where we are seen once again as leaders on the COVAX programme and other such programmes. So it's important that we focus on what's effective and how we can get vaccines to those who really need them.
Lady's question, the UK government played a leading role in establishing the medicines patent pool, a means of simplifying and accelerating generic production of HIV medicines by sharing patents. Does the Minister agree that a global pooling mechanism for COVID-19 would support countries' ability to access the vaccines and drugs required to control COVID-19 infections? Will the government give its full support to the COVID-19 technology access pool and encourage UK pharmaceutical companies to licence through it?
Well, in terms of tackling coronavirus and helping those who cannot get access to even the first vaccine, while in this country we have known people going for their third booster or even their fourth booster when it comes to not fourth booster, fourth injection. It's really important that we act internationally. This is an issue that comes up at international meetings. We are seen to be leaders in coordinating, and we're doing much of this via the international COVAX programme, but also talking to pharmaceutical companies themselves about what more they can do.
My Lords, over 40% of people diagnosed are late diagnosed, people diagnosed later in life. So could my noble friend say what the government is doing in relation to this so that stigma is removed and people are coming much earlier for testing? But I welcome the government strategy as it stands currently.
Well, I thank my noble friend for making the point. I'm afraid I don't have the details specifically for the older population, but I will make sure that I write to her.
My Lords, the Noble Lord the Minister has mentioned stigmatised communities. UK civil society organisations have raised concern that previous global health strategies have failed to address the gender-specific aspects of HIV, in particular the priorities of marginalised women. So, can the Noble Lord the Minister tell us how will the FCDO's planned global health strategy address the underlying structural inequalities that contribute to the vulnerability of girls and women?
Well, the government has made more money available for the funds, particularly funds where it comes to helping young girls and young ladies in different countries. But at the same time, sometimes we have to work out what can we do as donors or as an international community to help address some of the structural inequalities in particular countries. We can name it, we can draw awareness to it, but how much deeper can we go in there? And quite often one of the best ways to do that is to support the NGOs who are right at the heart of the community, understanding these issues and understanding the structural inequalities on a daily basis.
Follow on the question from Lord Collins, but bring it to this country. There is still a general perception that HIV/AIDS is a gay disease. There's a growing proportion of the population that are infected who are heterosexual. Could I ask my noble friend to ensure that messaging is directed at heterosexuals as well as the gay community?
Can I thank my noble friend for making that very important point and stressing that this should not be seen as a gay disease, but actually a disease that heterosexual and other people can do suffer from. One of the issues in the HIV plan has been to make sure those communities who maybe have a sort of macho approach to a number of these issues are addressed, particularly in local community level. It's very different, but you also have to tread carefully, particularly with some of the ethnic minority communities, so it's not being seen to be stigmatising that community or blaming them and getting the right balance. But the fundamental point that my noble friend makes is very important, and I think we should repeat it, which is that HIV does not only affect gay people, it also affects heterosexual people and younger communities as well.
When the coronavirus struck us, within a year, remarkably, a number of vaccines had been produced to huge effect. But doesn't that stand in marked contrast to what has happened with HIV and AIDS? And isn't it amazing that 20 years after Lord Fowler did so much to establish a response, a proper response to HIV and AIDS, that we still haven't got the medical support that we need for this? Could the noble Lord the Minister take this back to the department and see what more could be done to improve the situation?
The noble Lord makes an incredible point that in fact not many people are aware that there is no cure as such yet. It really is about making sure that you reduce the risk of transmission and making sure that those who contract HIV are able to live longer, as opposed to the beginning of the 1980s when this epidemic really hit us, sadly, and many people lost friends, loved ones and others prematurely. But the point that you make about looking for a cure, let me assure you the department is very aware of that. In fact, in my briefing for this, I did ask the department, how come we still haven't got a cure after so long? And it's a question that continues to be asked. And let's pay credit to the pharmaceutical industry and the medical professionals. They have tried.
Lord, say what steps are being taken with those members of the Commonwealth who have difficulties over accepting and supporting the gay community?
The noble Lord makes a very important point that we should address and be aware, and we are aware of certain countries. I have been warned not to name and shame them, sadly, but we are aware of those countries which do stigmatise or discriminate or have some other explanation. And one of the best ways to do that, sometimes sadly, is not via government-to-government help, but making sure that we get to NGOs who are working with people on the ground. But also at the macro level, in international forums, we can raise this issue on the list. And the UK, to our credit, is seen as a world leader when raising these issues at different diplomatic fora.
We heard earlier the HIV AIDS has always been perceived as a gay problem, which is of course a fallacy, but also it's been perceived as something that young people are more likely to contract. In fact, the facts show that the over 50s have been for the past decade the fastest growing group who contracting HIV AIDS and living with that into quite senior age. Can the Minister say what's being done to target that particular group, that it isn't just young people that are affected by this, but they should also be vigilant in terms of protecting themselves against HIV AIDS?
Well, the Noble Barriers makes a very important point that we should all be aware of, and it's great that we're all living longer, and I'm sure Noble Lords will agree it's great that we are being sexually active for longer as well. But in terms of addressing the particular issue, the HIV plan sets out how we look at different, if you like, for want of a better word, different segments or different parts of different communities and where the issues are and how we target messaging there. That's the most important thing, rather than trying to have a one-size-fits-all, which could be ignored by others.
My Lords, of course, there's been a huge amount of progress in the last 30 years since I was going to say my noble friend, I think I may say my noble friend Lord Fowler did the good work that he did. But there is still work to do in this country, and I noted that the noble Lord the Minister referred proudly to the fact that in this country there is perhaps less stigma than there is elsewhere. Well, I think it's true to say, my Lords, is it not, that we have no room for complacency in this regard, and that is one of the main reasons still why people who perhaps should be tested are not being tested. So could the noble Lord tell the House what is the government's current assessment of the infected but untested rate of HIV/AIDS in this country?
Well, I'm afraid I don't have the specific figure for Noble Baroness, but the action plan does set out how we're going to increase access to HIV testing and scale it up, focusing on populations and settings where testing ratings have not been high to make sure that we can tackle this, but also we ensure that new infections are identified rapidly and people receive the necessary treatment faster to prevent complications. The government in 2022, HIV Testing Week 2022, will operate the annual testing week there, and the campaign will be called It Starts With Me, which is due to take place between the 7th and 11th of February. And during that week, we will open self-sampling HIV testing services for all residents of England, but we want to make sure that we have lots of different programmes raising awareness. And I know a number of Noble Lords across the House do take this issue very seriously, and I would welcome advice from Noble Lords.